All right, well, time to ask the pediatrician. Today we're talking about children's heart health, and joining us is Dr. Elliott Pearson, pediatric cardiologist at Palm Beach Children's Hospital. Welcome. Thank you so much. You know, during the month of February, we tend to focus on heart disease, heart health for men and women, but for children, how common is it?
Well, it depends what you're talking about. For congenital heart disease, which is a heart defect that a child might be born with, it's just under 1% of the population.
Okay.
But also, as pediatricians, we're all seeing more and more high blood pressure, high cholesterol in our older children and teenage children, which has repercussions later in life. So that's also an important point to remember.
So that would go along the most common types in terms of heart disease. Are there different types per se?
Sure. There's many different types. I would probably classify it into what you're born with and then what you acquire after you're born. So when we think of adults who have a heart attack, for example, from a lifetime of having a high blood pressure, high cholesterol, that's sort of an acquired heart disease. And we see different forms of acquired heart disease in children.
Wow.
But there's also one thing I see a lot as well is congenital heart disease, which is something that children are born with, and then it's a matter of medical and, if needed, surgical management as they go forward in life.
So depending on if it's at birth or something you acquire later down the road, the course of treatment is probably different. What are the more common forms
of heart disease?
Yeah, of treatment options.
Treatment options, it varies. You know, some children are in a fortunate circumstance where they don't need any medical or surgical treatment. It's just about appropriate monitoring. So making sure that they follow up with their pediatrician and follow up the pediatric cardiologist on a regular basis is important. Because we may be monitoring for something later on that needs either medicine or even possibly surgery, which would be the other two interventions we look at.
No, keep going. No, please keep going.
So some children may need medicine. For example, if they have symptoms or if there's a problem with their heart function, then medicine can certainly help assist them with the function of the heart or in the vascular system. But then there's also a subgroup of children who may require surgery. And surgery, you know, obviously no parent wants to hear that their child is going to have surgery. And we understand that. A lot of us are parents ourselves, but oftentimes when we recommend the surgery, it's because we're trying to prevent worse problems or further problems later on in life.
When you look at the treatments that are available nowadays, how are they different from 15 years ago? Obviously more advanced.
Things are always evolving, and that's one of the things I love about what I do and I love about my field is you just see such a variety of things, even with people of different ages with the same type of defect. They've been managed in different ways. I would say the biggest thing nowadays is that from a surgical perspective, and I'm not a surgeon, right? But from a surgical perspective, we're trying to do less and less invasive procedures.
I'm afraid we're out of time. We're going to leave it at that. I know it can definitely get into a lot more, but we appreciate just that insight today. Thank you, Dr. Pearson.
Yeah, thank you.